Hi, everyone. Thank you for joining us today. Good morning, good afternoon, and good evening, wherever you are. We have 200 people registered for this event, joining from all around the world. So really great and glad to have all of you here. We will try to keep this event to an hour, and the way we will do it today is the three of us who represent Tau Ventures, myself, Amit, Sanjay, and Sonal. We'll start off by talking a little bit about Tau Ventures, and then we'll have 5 of our entrepreneurs present. We have pre-recorded the videos from the entrepreneurs just to make it easier so that there's no technical issues, but the entrepreneurs will be here in person live to answer any questions after any video. And the way to ask questions is everybody has a chat available. You can see that many people have been sending messages. So during a video, if there's anything that gets you interested, excited, or you're curious, feel free to send a question over chat. We'll try to take up as many questions afterwards, probably 2 or 3. But you're obviously welcome to engage with any of the entrepreneurs afterwards also. The group today includes many of our LPs, advisors, obviously the entrepreneurs, co-investors, and allies in general who have been very helpful to Tau in this journey. So exactly once we have hit 100 people, which is now, would be a good moment for us to go into this next slide. So I'll quickly introduce myself. I think many people in this webinar know who I am. I'm one of the co-founders of Tau Ventures. My experience is listed on the slide. I've previously worked at 2 other venture funds, Samsung Next Ventures and Norwest Ventures. Norwest is where I met Sanjay, with whom I started this fund. I've also been an operator at Google for many years and also a founder at Health IQ. And academically, I've gone to school at business school at Harvard and done my undergrad and master's at Stanford in health and in engineering. And I'll pass it over to Sanjay so he can introduce himself.
Well, thanks everyone for joining us today. We're excited to have you here and look forward to sharing more about Tau and also engaging over the Q&A. Briefly, my background, I've known Amit for about 10 years. We got started at Norwest Venture Partners and had been thinking about doing the fund for over a decade. Before that was at McKinsey and Microsoft. And what we're hoping to do here is work very closely with entrepreneurs and other venture investors to be one of the most helpful early stage venture funds out there. So.
And hi, everyone. Thanks so much for joining. Very quickly with my background, I've known Amit and Sanjay for the last 1 year. Has been really great working with them and seeing them work with entrepreneurs as well. I completed my MBA from Wharton just last year in healthcare management and finance. Before that, I was leading business development and growth at Asian Heart Institute, which is one of the largest cardiac providers in India. And before that was an assistant manager in corporate strategy at Aditya Birla, which is a large Fortune 500 firm in India.
So Tau Ventures is about a year old. We're a $17 million fund. Maybe folks have seen some publicity recently. We'll talk more about it. We are headquartered in Palo Alto, which is at the heart of Silicon Valley, and we focus on seed investments. We're open to looking a little bit earlier, a little bit later after that, but really the core focus is seed, and in 3 verticals: digital health, enterprise, and automation. And what we mean by automation is cars, robots, and so on. The underlying theme in these 3 verticals is AI. We believe that AI is ceasing to be a vertical, it's becoming a horizontal. It's similar to the revolution that happened 15 years ago with mobile or cloud, or 20, 25 years ago with internet. AI is powering everything, and at some point very soon, we are not going to be talking about building AI companies. It will be understood. We're really focused on entrepreneurs who leverage AI and apply it to building solutions, to building products that they really understand well. And we have done 14 investments. 8 of those were investments that we did before starting the fund that we put into the fund. And then we have done 6 more investments in this last year. We're looking to do 20 more, so for a total of around 30 companies. that we'll have in this portfolio. We typically write checks of 250 to 500. We do syndicate them with LPs. Many of you who are on this call are co-invested with us directly into those companies. And the lens is really to invest in companies that are 9 to 18 months away from raising a Series A. We come in and help them, especially with getting more customers and with getting more investors. And you will hear from a bunch of our entrepreneurs. They'll describe this in more detail. The goal here is to build a second fund and a third fund and a fourth fund. We are building this as an institution to be bigger than us. And we're planning to have our second fund sometime next year. And thinking right now about making a fund that will be 2 to 3 times bigger than the current fund. So next slide, please. Here's a quick overview of our current portfolio. There's a lot more information online. If you click on any of those links online at tauventures.com, you'll get a lot more information. 5 of these entrepreneurs are presenting today shortly. You will notice that health has been about half of our portfolio, and the other half is enterprise and automation. Health has been the biggest vertical even before the pandemic hit us. We believe that will continue being the case. And some of the investments are in stealth because we're respecting the wishes of the entrepreneurs. Next slide.
And so far, the portfolio, 80% of our companies have already gone on to raise the next round from many tier 1 VCs, some of which are on this call and others. In a lot of ways, it's a great time to be an investor. Looking back at the different vintages of funds, the 2010 vintage funds, the 2011, and I think similarly the 2019, 2020, 2021 funds will have a great opportunity to invest in a new set of companies. And in fact, from what we've seen in our pipeline, it's gone up at least 200%, if not more, and valuations have come down significantly. In general, about 25% from what we saw at the beginning of the year. We ourselves are adapting to COVID like everyone else, but I think in general, the filter we're using is trying to help put together rounds that are a little bit larger, that give companies a little bit more runway. In fact, we just did a deal 2 weeks ago where we were the first check-in and syndicated the whole round ourselves by bringing in other VCs that we knew to ensure that there was that longer runway. And hopefully you saw we were featured on the front page of TechCrunch for 2 days over the weekend 2 months ago. And we're able to get a lot of publicity and a lot of other entrepreneurs and investors and collaborators through that coverage in the event and of the fund. And so why AI? I think many of you already know this, but there's been a sea change of things that have happened. Cheaper storage, but a lot of data that's come out of different instrumentation on devices. The processing infrastructure is readily available, whether it's from GPUs or other cloud-based services. And there's a huge new set of algorithms and infrastructure, whether it's TensorFlow from Google or the Azure platform, that make doing AI a whole lot easier than 10 to 15 years ago. And with all these devices and sensors, the data necessary to change the operating models of businesses is really enabled by the fact that there's so many different collection points. As Amit was mentioning, we do a lot in healthcare and automation. And both these two industries have, in the last couple of years, become much more friendly to regulations that allow for remote patient monitoring, remote engagement. And these are all areas which were difficult to get instrumented. And now that they're being instrumented through these remote patient monitoring methods or remote monitoring methods are really now enabled for the next level of AI. Next slide. I think many of you already know this is the timeline of AI, but it's advanced quite a bit over the last 30, 40 years. Go to the next slide. And so really we've gone from this kind of descriptive world to a predictive world to a prescriptive world, in that where we're not just talking about descriptive statistics, but we're really talking about insightful predictions and recommendations. And I think there's a couple good frameworks out there, one of which is put forth by one of my former professors from HBS, but it's linking the business model of the company with the operating model of the company. And in many ways, that's one of the things that we look at also in our portfolio companies, which is when it comes to AI, it need not be AI for the sake of AI. What we're really looking for is a platform, a workflow that makes, with the use of AI, something radically different. And that often involves a really good business model to capturing the right set of data, and a really good business model to doing something with the data that's captured and powered by AI. And so many of the companies that we look for in healthcare, in enterprise, or in automation are doing something unique in the workflow in addition to the AI aspect of it. And so with that, what we'd like to do is talk and introduce some of our companies in the portfolio, and then we'll circle back and do some questions as well.
Sure.
Yeah. Hi, this is Dennis from Totient. As Amit mentioned, we started Totient with a large R&D team, and Totient was really started based on the observation that next generation sequencing it's one of the few phenomenon that's been improving faster than Moore's law.
Thanks for the presentation, Denise and James. Really appreciate the kind words. Our next presenter is Neve, founder and CEO of Biotia. Neve did her postdoc at Cornell, from where she spun out Biotia. She has built a really impressive team with all 3 CXOs holding PhDs. The company itself is based on truly groundbreaking technology and has been working relentlessly at the forefront of the COVID response in New York since the beginning of the pandemic. We're excited for them to succeed, obviously not just as investors, but also just as human beings, really feel that there's an urgent need for the solution in saving lives today. Over to you, Neve.
Great, thanks so much. I appreciate that intro, and thanks for putting this all together. I'm really excited to be a part of it. So I'm Dr. Neve O'Hara. I am the CEO and one of the co-founders of Biotia. And a little more of my background: I have a PhD in evolutionary biology with a focus in genomics. And at Biotia, we are fighting infectious diseases powered by genomics and AI. So our team, I'm just going to minimize this. So our team is a group of scientists, medical professionals, and health tech entrepreneurs. And we are coming out of Cornell Tech, Weill Cornell, and Columbia. And we've been pioneering the exploration of microbes. So everywhere from the human body to the environment, the New York City subway and hospitals, even to outer space. So our co-founder, Dr. Chris Mason, is a professor also at Weill Cornell and was the first to profile the microbiome at an urban scale, swabbing the New York City subway. We've been working extensively in hospitals and ambulances, and more recently working with NASA, getting samples from the International Space Station and describing new bacterial and fungal strains. So the problem that we are addressing is that we are in a medical crisis in infectious disease with outdated and limited testing tools. So right now, if a patient gets an infection, the leading technology is to take a sample and culture that in media, so in a petri dish or in media. And this is, and then look through a microscope to identify the pathogen. So this is technology from the 1800s. It's very slow because it's limited by the growth rate of the pathogens. And most species can't even be cultured, so you miss a lot of diagnoses. The alternative technology is PCR, or polymerase chain reaction. And this is technology from the 1970s. It's when you amplify a small segment of DNA in the total genome to identify presence absence. But it doesn't provide other additional insights beyond that. And it requires pre-design of a panel. So anything outside of that panel, you don't detect. So these limited tools have resulted in 18 million diagnostic errors annually, more than $100 billion in losses, extensive patient suffering, and about 80,000 deaths a year. So it's a big problem. Of course, it's been underscored by the COVID-19 pandemic. So we are selling into two growing markets. The first is the global infectious disease diagnostics market. It's about $20 billion. And the second is the life science research tools market, which is about $50 billion. And the way that we are addressing this problem is we are leveraging next-gen sequencing and AI software. So we have built Biotia ID. It's our software and lab toolkit for fighting infectious diseases. And with this toolkit, we actually sequence the total genomes of the pathogens. So this provides this remarkable insight into infections, what's going on, and the pathogen dynamics. So for example, we can identify drug resistance markers and virulence markers. We can see how the pathogens are evolving. We can identify new strains that are emerging and new outbreaks. And we can even quantify the level of pathogens in a sample. So this product line is in the market, and we are operating from our New York CLIA lab. It includes software, data, tests, and services. And on the research side, it drives innovation, and on the clinical side, it improves health outcomes and saves lives. So to date, we've raised 3.3 million, and we've accomplished a lot with that investment. So we have built Biotia ID and launched it. We've done a lot of validation and launched it. We've worked with a number of hospitals, Memorial Sloan Kettering, Weill Cornell, Atlantic Health System. We have been seeing a lot of traction this year. So we have more than 5 paying contracts, including with NASA, XPRIZE, and we've partnered with a large biotech company to co-develop a sequencing-based test for COVID. And you can stay tuned. We'll be giving updates on that soon. And we are in the midst of launching a raise, and we'll be raising between 5 and 7 million. And I'm happy to discuss that further, and feel free to reach out with any questions around that. Here's my contact, and thanks so much. Thanks so much to Tao.
Thanks, Neve. I'll try to get you. Great. On video.
Yeah.
Hi.
How's it going?
So thanks so much for the presentation. We have some time to take some questions.
Any attendee can type those questions over chat. Send it to everyone, please.
I think it was crystal clear, I guess.
Oh, great. So we have a couple coming in.
So Neve, maybe you can take away the first and the second question that came.
Yep. So the first, how would you differentiate what you are doing versus Carius? So yeah, Carius is one of our closer competitive companies. So they are focused specifically on blood and looking at sepsis. And we are focused on, we've built out databases focused on urine, stool, and respiratory samples. So that's a big differentiator. They're also on the West Coast. We are in New York, and we have a New York CLIA lab, which is a big barrier to entry there, because New York State has the highest bar for setting up a CLIA lab. So we've been, I think some of the inbound for partnerships with biotech has been driven by that New York CLIA lab and that sort of access. And then the second one, sequencing compared to other approaches heading to market re-COVID. I'm not sure what that means. Sequencing compared to other approaches.
I think re means regarding COVID.
Yeah. So I guess maybe you're talking about it in specifically related to regulatory barriers. It's not super clear, but I'll speak to that. So basically, the FDA has been allowing emergency use authorization of a lot of tests. Almost all of the tests, and there's hundreds now, are PCR based. And so that's the standard of care at the moment. There's only 2 and emerging next-gen sequencing based products. And so that is like a really new area, and we've actually co-submitted a new test that's sequencing based that's under review at the FDA. So we do hope for it to be one of the first sequencing based tests. I don't know if there's more time.
Yeah, Niv, we got 4 more questions on Q&A, and we got 4 more questions here on chat. In the interest of time, you pick whatever 3 other questions you want to answer.
Oh, okay. Okay, next one is, are samples currently sent in and sequenced in the lab? Yes, so samples are sent in. We basically have a couple different models. We partner to develop new technology, and we launch that co-developed technology, which is highly scalable. But in our lab, we provide services, and it's kind of like a hub where we provide sequencing services to develop new products, which we spin out to other labs. So that's what makes the company basically like a scalable model. And so a couple other questions, the timeline on testing results. We actually offer some really rapid tests in our lab, which are PCR based, and then the sequencing based tests take a little bit longer. It's a couple-day turnaround time. And that is because we are doing this, sequencing the total genomes and providing a lot more insight instead of just presence absence. And then sensitivity and specificity of your test versus RT. So our test is about 98% sensitive and specific compared to the gold standard RT-PCR tests. But we think that it's actually better than RT-PCR. You can only compare to the gold standard in these situations, but we think that, RT-PCR is also flawed. And because we're capturing the total genome, we have a lot of markers that allow us to differentiate between different species. And so we do actually anticipate that this test has higher sensitivity and accuracy.
Neva, I think you answered super efficiently. So we actually really only have 2 more questions. So maybe we can address those. I think we have time. So
yeah.
Pete Moran is asking, how long will it take to culture something like staph? And I'll let you do that. And then there's the final question.
Okay, I don't see.
It's actually in the Q&A. Yeah.
Oh, yeah, I see the, in the Q&A. Okay, how long? So we don't do any culturing. Staph is a pretty fast-growing pathogen, but most pathogens, when you culture them, take anywhere from 2 days to 6 weeks. So a lot of fungi are slower growing. Tuberculosis, the bacteria that causes tuberculosis, is really slow growing. That's like a 6-week growth rate. So it varies based on the pathogen, but it's slower than sequencing across the board. And then I think there was another question about preventative medicine. We haven't been doing any preventative medicine. I'm wondering if you're kind of referring to like microbiome, sort of like diet related to microbiome or something along those lines. We are focused fully on infectious disease. And as we build our database, we probably will move into more like of a health platform, but really the etiology, and it's simpler to focus basically at this point on pathogens until we have like a massive database that allows us to look at more subtle sort of health issues.
Great, Neve, thank you so much. I think in the interest of time, we'll move on, but everybody here, all 134 people on the call, feel free to reach out to Neve for further questions and to help her in case you're interested also in the Series A that she's raising.
Thanks,
and we can go over to Iterative Scopes.
Thanks for the presentation, Neve. Up next is John, founder and CEO of Iterative Scopes. John holds an MD, went to MIT for his MBA, and Harvard for an MBH. He was born and raised in Singapore, where he has been, or rather practiced medicine for 2 years. And prior to that, he built a hospital in Cambodia, which has been running for the past 15 years. If you're wondering how does he get the time to do all of this in sleep, it's probably that he doesn't. since we get messages from him at 4 a.m. and 4 p.m. often in the same day. Over to you, John.
Thanks, Onal, for the brilliant introduction. And thank you, everyone, for having me here today. I just need to warn you that we will be showing some highly visual images and videos during this presentation. So for those of you who are sensitive to this stuff, too bad. Well, I represent Iterative Scopes, and we see ourselves as a leading source of gastrointestinal intelligence. So what would you do if I told you that your life depended on your doctor's ability to find a polyp in this video? There is a very large, obvious polyp right now that should stand out to you. Well, through our work, we've proven that we can reduce your risk of cancer by over 50% by just simply identifying suspicious looking areas and bringing it to your doctor's attention, just like this big blue bounding box. Now, this is being done in real time, and we have already deployed it into clinics here in Boston and New Hampshire. We are about to deploy this into the 3 largest healthcare systems in California by the end of this year. Now, I'm Jonathan, CEO and founder of Iterative Scopes. I lead a tremendous team in collecting and organizing vast amounts of data in the gastrointestinal space, leveraging it to develop tools that are useful to both clinicians and the life sciences. We have the ex-CTO of Optum Analytics, the ex-head of licensing and agreement of a large pharma company, as well as a professor from MIT, leading up various divisions in our work. All three of us are serial entrepreneurs with multiple companies under our belts. And now we have come together to make this vision a reality. Now, for our next example, and it gets even better, the area of inflammatory bowel disease, a $35 billion pharmaceutical market. We depend on the interpretation of humans of these complex videos to determine the severity of inflammation in the bowel like this, scoring it essentially on a scale of 1 to 100 to determine the effectiveness of drugs. Now, the success of these multi-billion-dollar trials depend on it, this simple interpretation, and in turn, the hundreds of thousands of lives that consume these drugs on a lifelong basis. Now, the FDA has recognized the importance of these endoscopic findings, but we have yet to update our systems to be able to score these videos accurately and appropriately. Now, this is where our systems come into play, where we are deploying computer vision algorithms in pharmaceutical companies to help automate and reduce the variation in the way we interpret these videos. So already in the existing ongoing trials in the space, and there are 173 trials on IBD biologics, 116 of them have endoscopic endpoints. This emphasizes the importance of these findings and the correlation between endoscopic remission and the actual health of a patient. We have just signed a large pharma company in co-development deal, and we're signing 2 additional ones by the end of this year. Additionally, we are gathering vast amounts of data from top institutions from across not just across the US, but internationally as well, partnering with the national registries of the UK, France, as well as Israel in the development of these tools. Now, we have had a phenomenal journey, particularly with Talvengers. Thank you, Amit and Sanjay. Huge shout out to the 2 of you. We are raising a $12 to $15 million Series A soon. And if you are interested, we would love for you to get in touch with us. Thank you.
John, I would turn on your video and audio, and there's a few questions already coming in. You're on mute, by the way.
Oh, damn it. Hi everyone. Yeah, it's always weird to hear myself speak. And thank you for coming, and thank you, Amit and Sanjay, for having me here tonight. So a couple of questions, I'll take them down. Do I have unrestricted use of data? As of now, the agreements that come in, yes, we have used, I wouldn't call it so much of unrestricted use. We have rights that would allow us to use it for all commercial requirements, which is as much as we need to do. We wouldn't want to put these colonoscopies into the dark web or something. So, you know, we that's as good as we need. Do we see these algorithms applied in other fields? Absolutely. So we're right now focused in the GI space. We see ourselves very much as a GI intelligence, a gastrointestinal data intelligence platform. However, depending on our findings, I think there is vast application into other areas of immunology, particularly with rheumatoid arthritis, psoriatic arthritis, and similar diseases. So the next question is, how far along are we in the regulatory process? US versus OUS. I assume that's the EU, outside of US, right? Okay, so within the US, we've had 4 key submissions with the FDA, very, very positive. We've already agreed to a trial and design. We were actually supposed to launch a very large randomized controlled trial earlier this year in March. However, COVID hit us and we had to put that in pause, but we're due to restart that by the end of this year. We have, however, conducted 400 patient study already till date. This is done in exactly the same conditions as we would have done our FDA pivotal study. And in that study, we found that we managed to increase the detection of our precancerous polyps by anywhere between 70 to 90% over baseline. Do we see this applying this technology to capsule endoscopy? Absolutely, that should be a relatively low lift. Are we considering entering into breast cancer? Probably not so much into breast cancer, more we see ourselves entering more into complex diseases, into more complex diseases which have diagnostic difficulty. There's a ton of companies already out there looking at radiology, just by the nature of the data set in radiology. So in radiology in particular, you know, we take those X-rays and MRIs and we store it in a large PACS system. That enables a lot of discovery and work to be done on it. In our systems, we actually capture these videos as well as patient records in a proprietary fashion. These aren't stored in the large bank anywhere. And so that forms a pretty nice defensive layer for us. Can we query the gut biome with imaging? We actually are right now in discussions with one of the largest microbiome companies in co-running a study looking at the impact of the microbiome on IBD patients in this space. So absolutely, we see that. Do we have any partnership with Japanese medical institutions? No, we do not. We would love to have one. Any collaboration with Asia Institute of Gastroenterology? No, we do not. We would love to have that. What we use our money for, and what milestones do we plan to achieve in this next round? For how long will it last? So this next money will last us for another 2 years after we raise it. So what do we're looking to drive commercialization. We have a good number of, as I mentioned, 3 of the largest California practices have some form of agreement with us. Some of them are commercial, others are running healthcare economic outcome studies. These large institutions tend to be very economic outcome based, but they see, you know, if our pilot study results hold true, this would be an unprecedented impact in our reduction of risk for colorectal cancer. What is the vision of the company? We're going to have to take a separate conversation there. Please feel free to reach out to me. And yeah, also, how much am I raising? So we are looking for anywhere between we're looking for $10 to $15 million in the next round. And we're open for discussions.
Great, John. Thank you so much.
Thank you.
I think we can move on to Cerby.
All right, I'm very pleased to announce our latest investment in Cerby, a very exciting cybersecurity company that is addressing the needs around shadow IT. Enterprise tools and security and cybersecurity are a big part of what we do here at Tau Ventures, and we've built a huge network of CISOs and CIOs. Co-founders Bell and Vidal are well-known entrepreneurs who have a history of success. Bell was the co-founder and CTO of Uyala, a video ad technology platform that was acquired for $500 million. Vidal has also worked with Bell from the days at Uyala and at Wiseland as well. We're excited to welcome Cerby to the Tau Ventures portfolio. Bell, over to you.
Excellent. Thank you so much for the introduction, and we're also very excited to be one of the Tau Ventures portfolio companies. So let's go and dive into it. A little bit of what was just covered, you'll see on these slides as well. But in terms of the team heading up Cerby, you're seeing us here. We are repeat entrepreneurs. We've had the opportunity to be able to take companies to successful exits. And about 6 months ago, Vidal, my co-founder, came to me with a very interesting idea, and the rest, as they say, is history. We're now 6 months into the building out of Cerby, and have pretty good momentum, not only on the product development front, but also on the commercial front as well. So let's get to the core of what Cerby is actually tackling. So as you heard, we're focused on the cybersecurity space, and specifically the security element that we're looking at is what is known as shadow IT. If you're not from the IT space, shadow IT might be a concept that you're not familiar with. So what is shadow IT? Shadow IT is referring to the increasing phenomenon or trend of how enterprise applications, how they're entering the enterprise, is changing. It's no longer the case that IT teams, procurement teams are the ones that are responsible for the vast majority of the applications that we use on a day-to-day basis. Because it's now become so easy for any individual to go and swipe their credit card, it's becoming the case that anyone can introduce an application that leverages or starts to interact with sensitive company data. And so, as it turns out, shadow IT is something that is having a more harmful impact than not on enterprises. And so that's the problem at a very high level that we're focusing on. And as you can see from here, the impact of shadow IT does tend to be more negative. And the specific dimension of this that we're focusing on is the security risk posed by shadow IT. Depending upon who you ask, for instance, a Gartner or a Forrester, anywhere between a fifth to a third of all cybersecurity attacks moving forward will actually be coming out of the domain of shadow IT applications. So that's the world, and that's the problem that we're focusing on. Now, shadow IT is a very large umbrella as far as the number of issues that you see. Our first use case focuses on what we believe is a classic example of shadow IT, and that's social media. So consider a couple of data points. First and foremost, on the importance of social media. 71% of social media users, and I'm not just talking about Zoomers and millennials, use something like a Twitter or an Instagram to get their news. And with the backdrop of the elections, that's probably a fact that we're all horrified by, but is a fact. This is a very important channel for news. Upwards of 73% of social media users also leverage the social channel to conduct product research, to understand whether or not a particular product that they're going to buy is a good product for them to go after. Now consider that 80% of hacking-related account breaches are still caused by passwords. So this vector is an attack vector that gets exploited quite frequently. Now, finally, consider that over 50% of enterprises have not changed their social network passwords in well over a year. And so what you end up with is the fact that social media, social networks, they're a business critical channel, but it's the only owned and operated channel that does not receive the same security treatment. And I should say it's not an owned and operated channel, but it's the only business critical channel that does not receive the same security treatment as your owned and operated channels do. And so this disparity is the first problem that we're solving with the Cerby platform. So let's dig into a little bit more of why it's also just not a password problem that we're dealing with. When you start to look at social media accounts and really any number of marketing and communication tools, what you realize is the access profile around these identities is very different. In traditional enterprise and traditional consumer, what you usually see is one user accessing one identity. But the moment that certain consumer and prosumer applications enter the enterprise, you actually start to see a very different mapping of users to identities. It's more of a many-to-one access profile where you have multiple users accessing a single identity. So as an example, one of the customers that we're working with is Fox, and across all of their properties, news, sports, Fox Television Station Group, they have upwards of 1,500 social media accounts, with every single one of those accounts seeing 20 users accessing them. And so this is why the IT and security teams at Fox say this is a 30,000 unit problem that they are not able to really wrangle with the Oktas of the world, with the CyberArks of the world. So that's where we're helping them. And a good way of thinking about Cerby is we are the only solution that helps our customers manage the complete life cycle of shared accounts. And we take a very modern approach to it. It's much more end user focused, where a CyberArk or a Beyond Trust might be very focused on the IT persona or that developer persona. What we realized is in order to be able to wrangle this version or this flavor of this shadow IT problem, you need to start from the end user first. You need to build something that is built to the level of usability that they're used to with social media accounts, as an example. And if you do that, you actually get them to participate in the security infrastructure. So this is the platform that we've developed. And again, leveraging Fox as an example, we're also working with customers like CNN, MGM, Discovery, and Mattel. We help them have very comprehensive auditing logs. When multiple people are accessing a single Twitter account, we know who actually tweeted what. For Twitter, when multiple people are using a single account, we can layer on our own role-based access controls. So that intern can maybe only retweet. They don't have access to direct messages, as an example. So it becomes a true security platform that makes these applications that are business critical, we upgrade them so that they can function the way that other enterprise tools do in the enterprise. So the last thing I'll touch on is, what is the market size for this opportunity? In our initial focus area, as we've mentioned with the first use case that we're going after, it is more media and consumer products oriented, specifically looking at that social media use case. And doing a bottoms up analysis, we're seeing a total market opportunity of about 1.2 billion. As we branch out and start to tackle some of the other adjacent shadow IT problems, tackling the password manager issue more broadly, app management, app discovery, you end up getting to a place where this is effectively a 4.4 billion total addressable market that we believe we'll be able to pursue over the next 1.5 to 2 years. So there's a tremendous addressable market for us as we go and pursue shadow IT, and we look forward to working with the Tau Ventures team to go after that together and build a very big and successful product and company. So that's it for now on Cerby. Thank you so much, and happy to answer any questions that the team might have.
Thank you, Bel. Great. So we've got both Bel and Vidal on, and we'll take some questions as they come from the audience. In fact, we've got quite a few CIOs and CISOs in this group in attendance as I look at the panelists here, and so they may be good people to try things out with as well.
Excellent. Hi, everyone, and thank you so much. One thing, one of the questions here is competitors. Before I answer that, we did recently close a Series C round of funding, obviously with participation from Tau Ventures. It was led by Bowery Capital, but I had neglected to mention that at the outset of the presentation. Competitors, I touched on this a little bit in the presentation. Probably the closest space would be the privileged identity and the privileged access management space. So folks like a Thycotic, a Beyond Trust, or CyberArk. But what we found is when you ask a marketing person to use a heavier duty tool like that, you get fairly significant organ rejection. And so that's why our focus is how can you work on this from the end user back so that you get the same level of kind of governance and auditing capability, but in a way that it's frictionless to their existing use case. Another question, you focused on the social media shared account use case, but could this be used more generally for any shared administrative account? Yes, exactly. For service accounts, especially on the development front. Actually, one of the major use cases that we see is around developer accounts for Apple and Android. So really any situation where you have distributed access to an individual identity, which is actually occurs quite a lot. You know, we as humans like to share things, and credentials are no exception. This approach would work very well. Another question, with the pressure on big tech, what is the potential that social media companies develop this tech internally? Great question. We have been speaking with a number of those companies, and really where there's a moat of sorts is this blurring of the personal and the professional identity. You know, someone like a Facebook, their notion of an identity is your personal profile, which isn't in some LDAP system that an end user has. In fact, you know, to be able to access a Facebook business page, you need to link it to your personal Facebook profile. And so what there needs to be is a bridge between the professional identity and the personal identity. And so that's where you know, we come into play. That's something that you're not necessarily going to see a network. And in our conversations with the major social networks, they're open to a solution like this providing such a bridge. Another question, would celebrity social media access management be a relevant use case for the technology? Yes, we have more started, well, some folks might say politicians aren't necessarily celebrities. We have been looking at the political use case. We have some contacts at the DNC and the RNC, and there is definitely some interest here. So that is a use case that we're beginning to get some data on, and the early data suggests that this is something that that they would be interested in. What is the sales cycle like, right from origination to contract? So we have two major buyers. We have the IT security professional, and then the line of business owner who, for this particular use case, because we're starting first with the marketing communication stack, is also the marketing buyer. What we have seen is if you come in via IT and security, it's a slightly slower sales cycle on the order of 3 months. Marketing, it's a much shorter engagement from what we have seen. You know, these are also the users that are major causers of shadow IT. So that tends to be a fairly short engagement to a smaller license. So depending upon which persona you're targeting, it tends to be a fairly fast engagement. Identity is a very large field. It looks like you're not really shadow IT, but more identity management for social media. You know, the framing that we would look at is there are a number of problems that are pervasive around across shadow IT. What you see with social media applications is that you have a number of non-conforming applications that are not OpenID or SAML based in terms of their auth protocol, or at the other end of the spectrum, in terms of how end users end up logging in, it's not user directory based, right? It's not a one-to-one mapping between a user and an account. And so those problems are actually very common across the shadow IT domain of applications, that they don't support the security best practices, nor do they have kind of this many-to-one access model. So it definitely, I can see how the framing could look like purely identity management for social media, but what we've seen is as we solve this problem for social, it's actually a generalized solution that can be used to corral and bring into the management domain of security other apps that are non-conforming.
Hey, Bell and Vidal, this was great. In the interest of time, I think you got a lot of questions here. But maybe any parting words, and then we can move to the next group.
There's another question here. Thank you, TS, for the compliment. Another question here from Q Motivala, which is, what are we seeing in terms of valuation for the C stage in Q3? So we have noticed a drop in valuations across the board. around 25% from what it was pre-COVID. The rounds we have been focusing on, mind you, we invest in the US and Canada, and really heavily in the East Coast and West Coast. So there are geographic differences in obviously those two countries, but we're looking at rounds around 10 to 12 on average as a post. And the seeds, 3 to 4 million on average. Sanjay, I'll pass it over to you for the next question.
Yeah, how has it been doing the question is, how has it been for us to do the due diligence and investments virtually? So I think March and April were pretty tough in terms of just navigating that environment. But what we've done during the time is a lot of events and a lot of talks to build a pipeline. And at this point, we've now done 4 deals in the last 3 months, all done virtually. One of the factors we are encouraging companies to do, though, is raise a bit more capital. And what we've done, in fact, in the last deal that we did, we syndicated the round with 3 other VCs. And so there are a lot of different folks around the table who are there to help and support the company at the early stages. Whereas perhaps before, in some cases, it's actually better to do 3 or 4 big parties versus 20 smaller checks, or even just 1 for that matter.
I'll take the next one. What are the next big healthcare opportunities that you're seeing, broadly speaking? The single biggest theme for us in healthcare has been oncology. And you saw a taste of that today. Totient is focused on using machine learning to develop antibodies for COVID and for cancer. Iterative Scopes, which was the 3rd company to present, is doing computer vision for colonoscopies. We have another company that didn't present today, but that had presented last year, called PhytoCure, that is looking at cancer in dogs. And in general, I mean, cancer is, there's multiple trends here that are converging. You have societies around the world that are getting older, we're living longer, we are polluting more, there's a lot more carcinogens in the environment, and we're detecting cancer early. And detecting early is really the key for treating. So we continue believing that there's a tremendous opportunity here to try making a dent, a meaningful dent in oncology. You can see some of the acquisitions that even have happened recently. Grail getting acquired for $8 billion is representative of the excitement around cancer. The other areas, the big one is chronic disease management. So we have seen a number of companies that have been developed around diabetes. Livongo's recent merger for $18.5 billion is perhaps representative of what's happening there with diabetes, but there's many, many other conditions that we're just starting to tackle, obesity being a big one. We've actually taken a bet recently in obesity. The company is in stealth, but we'll be sharing more about that company as soon as it's out of stealth. But you have respiratory conditions, asthma, COPD. You have mental health, which is historically been very underserved. You have Alzheimer's and Parkinson's, which are also mental health and diseases of aging. So we are really looking for folks that are using computational power, a lot more data that's available, and trying to solve these problems that have historically been really hard to detect, to treat, and perhaps even cure. So Sanjay, to you.
An update on new investments in 2020. In the last 2 months, we made 4 investments, but as you probably know, these things are in the process for a long time prior to that. How has your diligence process changed during COVID, and if so, in what ways?
Sure, I can take that one. So we talked a little bit about this in today's call. What we are investing in hasn't changed. We're still very much the same thesis we had. In fact, we feel vindicated in many ways that we were investing in automation and in health and in areas of enterprise that have become so much more relevant in the world now. So that hasn't changed. What has changed, I think Sanjay was making that point earlier, is that we're looking for rounds that are a little bit bigger. So if we are typically co-investing with another VC, and we want the other VC to also be a good fund, to be a stable fund. We want to make sure that there's enough capital around the table. Another way of mitigating that is making sure that the company's burn is controlled. So in general, our preference has been not that the company will raise its, not that the amount of money will last them for 12 to 18 months, but more like 18 to 24 months. So those are the two big changes that we've made, is making sure enough money around the table and that the runway is a little bit longer.
Some of the learnings of this year, though, include just the fact that what's happened here has opened up a tremendous number of new opportunities, and really the acceptance of certain approaches, all digital in the healthcare space, but also the transformation of work and work from home and what that means in terms of collaboration, communication management, understanding analytics about the home workplace and the office workplace. All of these things are here to stay. And so I think many of the bets that we're making here, companies that have taken capital are finding it easier actually to get customers in some ways in this environment.
And I'll take this as the last question to make sure all of us can, I guess we had one more question come through. So I'll take that one, then Sanjay, you can take the last one. What I see as the sweet spot between AI and mental health, what does that company ideally look like? The biggest challenge in mental health has been historically who pays for it. It's a underserved, underdiagnosed, underappreciated by society in general, by the medical community, by patients themselves. That is starting to change. It's not changed enough. And that has created problems around willingness to pay. So is it an employer who should pay? And that creates a whole set of questions around privacy and disclosing perhaps a condition to an employer. Should it be providers and payers, meaning doctors and hospitals and insurances, that there may be ROIs associated with detecting a mental health issue early and treating it, or should it be the patient themselves? So companies have struggled historically in that. And what does the ideal company look like? Honestly, is being able to solve it, is being able to crack it. And I think we're starting to see some examples. You have companies like Calm and Headspace that have been actually in the news very recently that have managed to get the engine working. So we are looking for companies like that. And in terms of where AI comes into, well, you have tons and tons of data. You can perhaps use voice to detect and diagnose an issue before it becomes much more symptomatic. You can look at the patterns at usage of social media and detect perhaps if somebody might be having a condition. And mental health spans a spectrum of conditions. It's very closely related to sleep also. So when I'm looking at deals in mental health, I often tie it also to companies that are solving sleep conditions.
And one more question, and maybe this will be the last one, around how are we helping with commercial leads? One suggestion I have for portfolio companies and any company that pitches is a meeting with the venture firm is a good opportunity to pitch your product to their portfolio companies. And so oftentimes one of the best ways to get customers is to pair a company that's coming in with companies in our portfolio and companies at other venture funds. And so that's one of the areas that we try to help out. And then also in addition, through the advisory network. And I know there's a lot of people on here, and we're always open to having more people in our ecosystem and being collaborative. So if there's a company or an area that you'd like to help out in and pair up, we'd love to be that bridge.
And Sanjay, I guess I'll take this last question here and then we'll close it. So has hiring been easier or harder for portfolio companies? It's a little bit mixed, to be honest. It is easier in the sense that there's more talent that's available. Companies have let go of people, even very large companies. I mean, famously, this was in the news, Airbnb let go of in the thousands in terms of really good people. And that has happened to other very large companies, very successful companies. So that has created an abundance of good talent in the ecosystem. The challenge for small companies has always been true is how to access that talent, because at the seed stage, you're not as well known. And that's where I think VCs like us come into play. We're connected to hundreds of people, thousands of people, and we do help filter and we do help provide the resources. So I will say that our companies have been reporting to us that they have been having an easier time hiring. I don't know if that's true generally overall for everyone. And with that, I think we'll close the event. We are really grateful for everybody who joined. We apologize for keeping you guys a little bit over here. We knew it would go over by a little bit, but at least it wasn't as bad as last year. Last year, the event went over by 2 hours because people just kept asking questions. So we kept you guys up by about 25 minutes this time. Really thankful to all the support from our LPs, of our entrepreneurs, of our advisors, co-investors, and we look forward to doing a lot more. So we'll have this event again next year, hopefully in person. We have wine glasses for everyone. And in the meantime, we just wanted to wish everybody to stay safe and look forward to following up.
Thank you, everyone. Thank to our panelists as well and all our attendees.
Thank you.
Thank you. Bye-bye.